In this video, I'm going to talk about untreated sleep apnea, a hidden driver of resistant hypertension and metabolic disorder. Yesterday, I saw a patient who is on 6 medication for blood pressure control. And after interviewing him, I found out that he used to have sleep apnea and he stopped using it 2 years ago. And since then, it has been so difficult for him to control his blood pressure. And he's on 5 medication. When he had sleep apnea treatment with the CPAP, he was only on 2 medication. And this is a known fact, and that hypertension is one of the most common chronic condition worldwide. Yet in many patients, it remains resistant to treatment despite multiple medication. A key but often overlooked contributor is undiagnosed or poorly controlled obstructive sleep apnea. How sleep apnea impacts blood pressure. Obstructive sleep apnea is characterized by repeated pauses in breathing during sleep, leading to intermittent hypoxia, low oxygen level, and frequent awakenings. This triggers a cascade of harmful effects. So let's talk about that. What is that triggers a cascade of harmful effects? There's a overdrive of sympathetic nervous system. Each apneic episode activates body's fight or flight response. This leads to surges in heart rate, blood pressure throughout the night. Over time, the chronic sympathetic activation raises baseline blood pressure and makes it harder to control with medication. Vascular dysfunction. Hyperlipidemia causes oxidative stress and inflammation in blood vessels. This includes nitric oxide availability, reduces nitric oxide availability, and impairs normal vasodilatation, which is enlargement of the blood vessels. The result is stiffer arteries and higher resistance against which the heart must pump. Hormonal and metabolic disturbances, sleep fragmentation, dysregulation, poor quality sleep elevate cortisol level, worsening insulin resistance. Leptin and ghrelin hormones regulating appetite are disrupted, fueling weight gain. Together, these changes drive the progression of metabolic syndrome, diabetes, obesity, all of which worsen hypertension. Resistant hypertension and sleep apnea. If a patient requires 3 or more medications for blood pressure control or remains hypertensive despite adherence, sleep apnea should be strongly suspected. Other red flags include loud snoring, witnessed apnea, daytime fatigue, morning headache, tiredness, obesity, central abdominal fat. What is the benefit of treating sleep apnea? If you take care of this, it not only improves sleep quality, but also directly impacts hypertension and metabolic health. Continuous positive airway pressure CPAP studies show that consistent CPAP use lowers blood pressure, especially nocturnal reading, and reduces cardiovascular risk. Weight loss. Reducing excess weight decreases airway obstruction and improves apnea severity, often reducing the need for multiple antihypertensive medication. Lifestyle changes. Better sleep improves energy, supports exercise adherence, and helps restore healthier hormonal balance. Impact on metabolic health. By correcting sleep apnea and restoring oxygenation during sleep, patients often feel much improved. Most of the time, I hear from the patient, they will say, "Oh my God, I feel amazing with the machine. I have so much energy. I feel like I haven't felt this good for many, many years." But as a doctor, we see that patient glucose control is improved, insulin sensitivity is better, lipid metabolism better, daytime alertness and cognitive function improves. Overall, cardiovascular outcome is better. So, in conclusion, I would like to say this: untreated sleep apnea is more than just a sleep problem. It's a major hidden cause of resistant hypertension and metabolic disorder. Recognizing the link between fragmented hypoxemic sleep and blood pressure control is essential in modern clinical practice. For many patients, treating sleep apnea and addressing weight management are just as important as prescribing medication, sometimes even more so. A good night's sleep is not only restorative, for the mind, but also life-saving for the heart and metabolism. So thank you for watching. I appreciate all of you guys there and who watches my video and engages me in some chit chat. So I'll see you again in different video.